The Supreme Court of Canada ruled yesterday that some people living with HIV don't have to disclose their infection to sexual partners as long as they have a low viral load and they use a condom during sex. Science has come a long way since the 1980s when HIV infection was considered a death sentence. For an update, we're joined by CBC medical contributor Dr. Karl Kabasele. Dr. Karl, what do we need to remember about HIV?
Well, at the end of the day, when we put aside the politics and the legalisms, HIV is a virus. We need to do our best to try to stop its transmission. And I know there are a lot of younger people who may not have lived through that initial epidemic in the 1980s, and it's important that they really understand what they need to do to take care of themselves.
How treatable is HIV?
The great news is it's very treatable. In fact, the standard of care is what we call antiretroviral therapy, which is a combination of at least 3 medications taken at once. The idea being you want to stop the reproduction of this virus and stop it from doing damage to your immune system. And we know that these drugs can actually stop the progression of the infection to AIDS, which is sort of the terminal stage when things start to go wrong with the immune system.
If someone is HIV positive, how likely is it that they will transmit the virus to someone else?
Well, it's worth repeating, first of all, that you cannot get HIV infection from casual contact, skin to skin, sitting next to someone, talking or interacting with them. It really requires intimate contact with bodily fluids, whether it's blood or semen or breast milk. Now, if a person is being treated for HIV and adequately treated with medications that lower their viral load, the actual risk of transmitting it to someone else is quite low. But regardless of whether or not someone's being treated, the standard is really using barrier protection, using a latex condom or a latex barrier for any sexual contact, and of course not sharing needles or other personal care products where there could be bleeding or cuts or what have you.
Where are we in our quest for a vaccine against HIV infection?
Well, there is a lot of ongoing research right now on HIV vaccines, and there have been some interesting findings, but no breakthrough yet. Probably the best study or results that we've seen so far was a vaccine trial in Thailand, but it was sort of borderline in terms of its effectiveness, so that work is ongoing. But maybe a more promising area is the idea of using pre-exposure prophylaxis, which is basically using the same medications that we would use to treat HIV, giving it to people who are at high risk but don't have HIV, so that if they come in contact with the virus, they don't get infected. And there have been a number of interesting trials in the last few years that have shown whether it's a topical application of these medications, and there was one study in South Africa where they used a vaginal gel that was impregnated with this drug, whether it's taking pills, sort of on a regular basis to prevent infection. There have been some promising results. Of course, it needs to be reproduced in other studies before it becomes the standard of treatment. Maybe I should also add that for a person who might have been exposed to HIV, whether it was in a hospital setting, whether it was through sexual contact, we also know that there's the idea that you can start treatment with these antiretroviral drugs, and that may actually prevent the seroconversion, the actual infection or changeover to HIV-positive status. So all of that really underlines the importance of getting tested, knowing your status, and getting care as soon as you can.
Now, we've talked about young people who may not have been around at the beginning of the epidemic. What about older people who maybe think that this is not part of their generation? How do they protect themselves?
And that's an interesting point, because with the rise of drugs for erectile dysfunction, with the increase of single older people who are dating and having engaging in sexual activity, obviously this virus doesn't see age, it doesn't see color, it can impact anybody, and therefore older people should also be taking the precautions. So using barrier methods if they're having sexual contact, and not sharing needles or other personal care items.
All right. Thanks so much.
Thank you.
CBC medical contributor Dr. Karl Kabasele.